Good morning. It's Dr. Jeffreys again. Today I'll be talking about thrush. This is the second commonest cause of vaginal discharge in women. Most women will have at least one episode of thrush in their lifetime, and I'll say that is if you're very lucky. Now, what is thrush? Thrush is a vaginal infection which is caused by a particular fungus whose name is Candida. Candida lives normally in parts of our bodies. For most people, they would have a little bit of Candida living down below. It normally thrives in parts of the body that is hidden, that is wet, and that's airless. And down below is a very good candidate because it ticks all the boxes. Now, if it lives down below, why then does it cause much trouble? Usually, the amount of Candida in your body is limited by a few other factors. For most of us, we have the good bacteria, which tells the Candida to stay put and not cause any damage. We also have our immune system that fights the Candida and keeps it under control. However, because the human body is very dynamic and it's open to changes, if there is any change in our immunity or the level of the good bacteria is reduced for whatever reason, then Candida starts to flourish. And that's when we get the symptoms. Now, what are the symptoms of thrush down below? Most women will complain about the itching. It can be really embarrassing because most of the time, you just can't stop yourself. Now, pause. Now, don't go looking at all the ladies you see at the bus stop, thinking that they have Candida. They may be itching for other reasons. Now, apart from the itching, it's usually very sore. Most people, if you take a mirror and you have a look down below, you see that it's a bit red, and at times it can have some tiny spots of red. So it's itchy, it's red, and it's sore. It's a bit painful. And the most pronounced feature is the discharge that you get. It's a creamy white discharge, which for people who know it, it looks like soft cheese. It doesn't always smell very bad. For some people it may. But the fact that it smells bad or doesn't smell bad should not be the criteria for you to decide whether it is thrush or not. Apart from the immunity in the body, and the good bacteria being absent, what are the other things that can make you prone to thrush? Let's start by your general well-being. If you don't take good care of yourself, if you don't wash yourself regularly down below, that can make you prone to thrush and every other infection that is associated with dirt. If you wear tight-fitting underpants, most especially ones that are nylon, you're likely to have thrush because remember, Candida flourishes where there is heat and where there is no air or less air. If you have to take antibiotics frequently, it gets rid of the good bacteria that normally suppresses the Candida, and that means that you're prone to thrush. Thrush is also very common in pregnant women because generally the immunity is a bit challenged. Now we know what thrush is. Now we know the symptoms of thrush. Now we know what can make you prone to thrush. I'll be stopping here, and tomorrow we'll be talking a bit more about thrush. Until then, take good care of yourself And remember, don't just whisk your knickers on, have a look at what's dropping inside. Thank you.